Hi, my name is Dr. Heather Kirchhart. I'm a veterinarian here at Columbia Pike Animal Hospital, and today we're going to talk about cat vaccines and help you better understand these vaccines. There are two types of vaccines for cats. There is core and there is non-core vaccines. The core vaccines for cats are the rabies vaccine and the distemper vaccine. That distemper vaccine is the FVRCP, and within that vaccine there is herpes, calicivirus, and panleukopenia. These vaccines are recommended generally for every cat, no matter where you live in the United States geographically. These vaccines target specific diseases that can cause some significant illness and even death. Non-core vaccines are optional vaccines, and they are given based on your specific environment and your cat's lifestyle. So there are three non-core vaccines in cats. There is the feline leukemia virus vaccine, there's the chlamydia virus vaccine, and there's the Bordetella bronchoseptica. The non-core feline leukemia vaccine is considered often in cats who go indoor-outdoor, cats who have a propensity to escape from their house, and also it is considered in young kittens or cats under 1 year. Cats who are 100% indoors and are adults over 1 generally are considered low risk for feline leukemia, and so often we do not give those vaccines to those kind of cats. We follow the feline practitioner guidelines that have been reestablished in 2020 when we're vaccinating our kittens for the core vaccine. For the distemper vaccine, we start their vaccinations as a kitten as early as 6 weeks, and they get the vaccine every 3 to 4 weeks till they're 16 to 20 weeks of age. Then their next booster is at 1 year of age, and then after that, it's every 3 years. For the rabies vaccine, it does vary state by state, but in the state of Virginia, vaccines for the rabies is no earlier than 3 months. They should have it by 6 months. Then they should get a booster at 1 year of age, and then it's every 3 years thereafter. And for the non-core, if it is determined by you and your veterinarian to start the leukemia series, that could be started as early as 8 weeks of age. They get a booster in 3 to 4 weeks. Then they get another booster at 1 year of age, and then annually thereafter. During your annual wellness exam, part of the discussion is the vaccines, whether or not you're going to be giving it, the risk factors, the frequency, discussing preventative medications if needed, as well as annual lab work. These vaccines provide protection against certain diseases that can cause sickness and illness, but really it gives you peace of mind that your cat can, if they do decide to go outside, can be protected against many diseases, and if they come to the vet or interact with other animals in their house, that they will have a lower risk of many of these diseases. Most healthy kittens and adults can get up to 3 vaccines in 1 veterinary visit. The exception being those who have previously had a vaccine reaction or some sort of adverse event. Preparing your kitty for a vaccination appointment, it starts at home. In general, if they have a favorite toy or catnip or a treat, or a towel, putting that in the carrier for transport prior to you coming. There are certain natural calming products as well, like FeLV, that you could consider spraying in the carrier before you come or putting it on the towel. And when you arrive, our waiting area, there is a separate cat and dog waiting area, and the cat waiting area definitely is much quieter. If your cat is overly stressed out and anxious and you have a very difficult time getting your cat transported to the veterinary office, please contact your veterinarian so that you guys can discuss possibly some oral medication to give at home to make the transport much less stressful and easier on your cat and you. As cats get older, there is a discussion in senior cats of whether cats need the distemper, the core vaccine, or if they still go outside, the leukemia vaccine. In general, senior cats that are healthy, that do not have any significant concurrent diseases, we will still recommend vaccinating for the core vaccines, and if they go outside, we'll continue to do the leukemia vaccine. because as seniors, it may even be more important to vaccinate against those things because their immune systems are not as robust. Thank you for watching this video. If you have any further questions, please come and see us here at Columbia Pike Animal Hospital.